Gestational diabetes is basically the fact that during the pregnancy, the mother's placenta, which normally causes growth to the baby, actually gives off so many hormones that it forces the mother's pancreas to work as much as 3 times harder to give off insulin to get the normal amount of sugar over to the mother. So as the placenta is a benefit for the child or the infant, it actually causes the mother's pancreas to work that much harder. We have now that most of our physicians are testing the mothers somewhere between 24 and 32 weeks or 34 weeks. They actually give them the 1-hour glucose challenge test in the office, and then they will, if the number is extremely high, they'll send them to us. If the number isn't, they may have them do the 3-hour test. I would say no, it's not preventable because of the fact that when it's the placenta around the baby that's causing those extra hormones to go off. So the mother hasn't done anything wrong. She couldn't have prevented it, and the baby will not have diabetes. And that is such a good question because of the fact that mothers really second guess themselves. And everyone we see, we offer to put it on tape that because it goes through their mind, what didn't they do, what should they have done different, why did they do what they did, and they actually did nothing wrong. I think it's a process, and when they do come in, number one, we reinforce that. Even to family members, we offer to talk to the husband if we need to. We give them written information that is appropriate so that they can take that home. In some cases, we've even given videos for the family to go home to share with the husband and other family members. We see them initially as a one-on-one or as a class, and then we will see them either in 2 weeks, or we may push it out longer if they're coming to us earlier. Some of the sessions now are 2 sessions, but we can also extend it as needed for each mother. Long-term effects is, whether it's untreated or not treated, is that is a risk factor for the mother to have type 2 diabetes down the road. So what we basically tell the mothers is what good changes they've made in their eating habits or their activity during pregnancy, that even if they keep just a little bit of it afterwards, that will help them. And we encourage them to have tests done at least once every 3 years. We help treat gestational diabetes. Number one, the dietitian talks to them about food. Not so much that they have to be on any kind of a special diet, but that they spread their food out throughout the day so that the pancreas doesn't have to work so hard, because we all know that none of us are really good at eating at regular times. So the pancreas sits there and it doesn't have to do anything if we skip breakfast and we skip lunch and then we hit supper and it's So we help them by spreading the food out, and the dietitians will work with them with the foods that they like. The other thing we do is we teach them how to do their blood sugars and what do their blood sugars mean to them. We stress the importance of keeping their appointments, because if they do not take care of this, we're going to have a very large sized baby, and that's where we get the big babies that are 10 pounds or more, and the fancy term for that is macrosonia. The other thing is these babies tend to be more hypoglycemic when they're born, so it means their blood sugars are low. They also could have some breathing problems, as well as we may find that they're more jaundiced. Also concerned for mother because she could actually increase her blood sugar and retain weight. They can actually call our department at 279-4974. Or through their doctor. They can get the order and call Central Scheduling at 279-7979.